Namaste, this is Anand Tulsidas Raut. Today I am going to discuss about the COVID-19 treatment. A suggestion. I found that maybe there are three drugs, that is nucleoside reverse transcriptase inhibitors, interferon and lung surfactant might be effective in the effective management of COVID-19. See, one by one we are going to study the drugs along with their mechanism, how it is being effective in the treatment of COVID-19. First, nucleoside reverse transcriptase inhibitors. That is nucleoside reverse transcriptase inhibitors, we know that is zidovudine, lamivudine, abacavir, dedanosine, stavudine, emtricitabine. This may be effective in the treatment. How? See, these nucleoside reverse transcriptase inhibitors, they may act on this transcriptase protein. Here, before we are going to study the transcriptase protein, we have just look on the coronavirus replication cycle. Afterwards, we will conclude how it is being effective. See, when coronavirus enters into the human host, it undergoes uncoding. When it undergoes uncoding, it forms genomic RNA, that is positive cyanide given because it is largest RNA. This undergoes translation to forms polyprotein, namely polyprotein 1A, polyprotein 1AB. This polyprotein again undergoes proteolysis, then it forms replicase or transcriptase protein. This replicase or transcriptase proteins get combines with the genomic RNA. That is genomic RNA that combines and forms a complex called as replicase transcriptase complex. This undergo replication and forms genomic RNA, that is negative sign I have given, and undergo replications and forms genomic RNA positive, ultimately viral progeny. At the same time, it may undergo discontinuous transcription and forms subgenomic mRNA. Then again undergo translation and forms viral protein, viral progeny. Now question is that how it has been effective. As we know, nucleoside means what? Nucleoside act as the building blocks for DNA and RNA. Here we are focusing on the RNA. As we are inhibiting the reverse transcriptase, that is nucleoside reverse transcriptase, the nucleoside of the RNA, because we are targeting on the RNA, because coronavirus is made up of RNA virus, that this might inhibit this RNA, that is nucleoside inhibit the RNA and reverse transcriptase. As we know, reverse transcriptase enzyme is always present with the HIV virus. Here, but I have seen that if this might be useful in the treatment, that is it might act on the replicase or transcriptase protein and prevent the further replication process. Second drug is interferon. Interferon is nothing but the signaling protein, as we know, signaling protein. This signaling protein, basically there are this signaling protein act on that is they inhibits the replication of this coronavirus. How? Because interferon, as the name suggests, interferon interfere. Here we are using type 1 interferon, that is interferon alpha 2b. It produced in response to viral infection. As we are externally administering interferon alpha, it has action on the replication of the virus. So it may act as being antiviral drug, it may act as a replication cycle and prevent the further viral progeny. So this might be effective in the coronavirus killing. Third is the lung surfactant, namely poractant, calfactant, beractant, lucenactant. As we know, the lung surfactant level decreases in ARDS in case of adults. But what happens here? The lung surfactant makes the function of alveoli by three ways. That is, lung surfactant decreases alveolar surface tension, prevent alveolar damage, enables the gas exchange and alveolar ventilation at low transpulmonary pressure. If you see the chemically, what is surfactant? Surfactant actually it is one of the surface active agent. Okay. See, when the surfactant has a property of denaturation and precipitation of protein. As we know, coronavirus is made up of spike protein. When the lung surfactant acts, it might kills or precipitate the or denaturate the spike protein, and might be this damage the coronavirus. See, these are the only suggestions I am going to give on the basis of mechanism, basic mechanism regarding this NRTIs, that is nucleoside reverse transcriptase inhibitors, interferon and lung surfactant. I hope this nucleoside reverse transcriptase inhibitors, interferon, lung surfactant might be effective in killing of coronavirus. So this chemotherapy, that is using the nucleoside reverse transcriptase inhibitors, immunotherapy interferon and pharmacotherapy using lung surfactant can be useful in the effective treatment of COVID-19. Thank you for watching this suggestive video. Stay home, stay safe. Jai Hind, Vande Mataram.